to know why my career as an esthetician didn't work out.
Because I was too honest and I was too blunt, and my morals and my integrity did not align with working with some of these dermatologists and these med spas.
Okay, no, she's not wrong. You have to remember that aesthetics or the aesthetic industry is very driven by money, okay? And there are two major classes of people who own aesthetic practices or med spas. You have doctors and you have business people. Let's talk about business people who go into aesthetics. So this is somebody who does not have a business background, who has learned or decided that, you know what, I want to own a med spa because this makes me a lot of money, or I've heard it makes money. And so I'm going to invest a certain amount of money into starting a practice, and I'm going to hire a nurse, a PA, estheticians, have a medical director, and they're going to run this practice because they're gonna make money, right? In situations where, let's say, someone of color comes in and they want a treatment, you know, a lot of the people who are practicing are incentivized to sell certain products, sell certain services, because you need to recoup the cost of machines. And so a lot of times those businesses are not going to actually take the time to figure out or to teach the people who are working how to treat people of color, right? I mean, me having a practice that focuses on people of color, it's just like a really brand new concept for a lot of people. And so you can understand how going into a med spa, for example, that doesn't have a medical doctor on board can actually lead to a lot of issues, like, you know, being wrong lasers or machines being used on you, or just a lot of different things can go wrong. Okay, so that's one end. And so a lot of times those types of businesses are very money driven, and the ethics or the ethos of the practice may not be patient centered. So keep that in mind. And then you have the other side. You have plastic surgeons, dermatologists, doctors like myself. I'm an internist who has an aesthetic practice, who go into aesthetics with different reasons, okay? Some people are also money driven. Yes, doctors are money driven too. Let's say a plastic surgeon or a dermatologist or a doctor owns a practice and they hire estheticians or they hire nurses. If the core value of the practice isn't clear, you can see how boundaries can get muddy. For example, someone of color comes in. If the practice does not have equipment that's safe for people of color, they should tell them that they don't have it, right? What you find in a lot of practices, they will say, yes, we can modify it to work for you. And again, they don't have the knowledge, or a laser company could have told them that, yes, you can use this for people of color, but not giving them specifications. So if you're a person of color, I just want you to I want to let you know that when it comes to aesthetics, slow and steady wins the game. You don't have to do big gun treatments. You can always start slow and work your way up. And don't feel pressured to get any sort of treatment. And for the estheticians and the PAs and NPs, like, you have your own values. And also don't feel pressured to sell a treatment or to do a treatment if you don't feel like it's the right treatment for the patient.